Yesterday, Boris Johnson announced that Plan B COVID measures, that's stay-at-home guidance, masks on public transport and vaccine passports, will remain for another 3 weeks. In this week's cover piece, Kate Andrews says the pass scheme needs to be stopped. Kate joins me now to explain her argument and to make the case for vaccine passports. Kirsty Innes, Director of Digital Government Unit at the Tony Blair Institute for Global Change, is also on the show. So, Kate, you went home just after Christmas to see your family in America, but it wasn't without difficulty. Can you tell us what happened?
So as I was headed to the airport, I went to download my travel pass, my vaccine passport, through a technology that we were promised would never become a vaccine passport, but that is, of course, what it is now. And I discovered that my record wasn't there. It said that my COVID record couldn't be found. I then clicked on my domestic vaccine passport, and I got a notice saying that I had had a positive PCR test, which was true. I was delayed in going home because I, unfortunately, like many people out there, got COVID before Christmas, and because of that my app was suspended. My vaccine passport was suspended for 10 days from when I tested positive on the PCR. Now this was temporarily very worrying because I thought my travel plans were busted again. As it turns out, because I'm an American citizen, that's the one country essentially I could travel to without evidence of my vaccine status. Had I been going anywhere else, I probably would have been grounded. But also the information was very odd to me and conflicting because in this country you don't isolate from when you get a positive PCR test, you isolate from when you first get your symptoms. So it didn't add up with the rules. And whilst once I dug into the fine print of government guidance, it turns out that this is how the app works. I don't think many people out there know that at the push of a button or the registration of a PCR test, your vaccine passport can be suspended. And the truth is this technology is far more powerful than politicians want to admit, and it turns out quite hard to control. I think so far this experiment of vaccine passports has highlighted a lot of the negatives, and we've seen very few of the positive things that the arguments around vaccine passports say you're going to get out of the scheme. I don't think it's too late to ditch it, and I think at the end of the month, if MPs are asked to vote again, we shouldn't just suspend domestic vaccine passports, we should be abolishing them for good.
Now, Kirsty, what happened to Kate seems like a glitch, essentially, because she was on day 12 of her isolation, but the COVID pass hadn't been updated in order to reflect that, and that meant that potentially she couldn't leave the country. But even so, even if it's not intended to have happened, this is the problem with the vaccine passport, isn't it? That it gives a government the power to limit certain actions, and a government that often is not less than competent.
Well, what happened to Kate sounds awful and certainly shouldn't have happened. I think if the government's going to offer this service, they've got to make sure it works. And absolutely, the vaccine passport should be in line with the current recommendations and guidance. So, yeah, that's a really bad glitch. But I think the good news is with the digital passport, that would have been relatively easy to fix and update so that the app does work in line with whatever the current restrictions are. Probably much easier than a more analog system where you've got people administering guidelines themselves and having to update a whole team of people who are doing this rather than looking at an app. But having said that, I think that one person's bad experience or one glitch doesn't undermine the value of the tool as a whole, which we have to look at as part of the whole society-wide, government-wide response to what is a global health emergency. The question is, if we think we need to take steps to limit the spread of COVID around society, how are we going to do that in the most targeted, proportional way possible? Are we going to have measures that affect everyone, like a blanket lockdown or blanket ban of some activities or blanket travel bans, as we've seen with many countries imposing restrictions on people who can travel based on where they're coming from? Or are we going to use technology to make that as smart as we can and just restrict it for people who we know are at an increased risk of having or transmitting the disease?
Kate, what would you say to that?
So to be clear, it wasn't a glitch. This is how the app works, and if you dig into the guidance, it decides to suspend your vaccine passport from after you test positive for that PCR. Now, again, I don't think MPs were aware that this is the way that the technology worked when they voted on it. I don't think any of this is democratic, but it isn't a mistake. It isn't one person's bad experience. There will be countless people over Christmas and since who will have discovered that actually, because of a technology that's already gotten out of the hands of the state, their movements are restricted. The way that they can go about living their lives is restricted, and there's no appeal process here. There's no number you can call. It's just computer says no, and all of a sudden your rights as an individual are suspended. And I think this is the inevitable outcome of something like a vaccine passport. You know, I don't think governments are, generally speaking, competent enough to control such a thing. But even if they were, we should all be very seriously concerned that the government would have a technology that could, at the click of a button, suspend the way we're going about our lives. And I think that the reason we can have this debate in the UK, and you know, a really honest and good debate about it, is that thankfully, compared to a lot of other countries out there, we don't have the same kind of vaccine hesitancy problem. We have one of the best booster uptakes in the world so far. We have an incredible vaccine rollout program. And for those who still don't want to get vaccinated, we need better education programs to explain why we need to do this. But broadly speaking, this is a country that wants to be vaccinated. And one of the benefits of our incredible success is that we shouldn't need this kind of technology to try to use essentially a digital stick to beat those who aren't compliant into doing what we want. Because, by the way, that doesn't seem to work in the UK. Some countries with relatively low vaccine uptake have seen that implementing vaccine passports has led to more people getting the jab. But here in the UK, when Scotland brought in vaccine passports, their jab rate was still in line with England that didn't have it. We're not seeing any of the so-called benefits that people said we would get out of vaccine passports. We're just seeing the bureaucracy, and frankly, we're seeing an erosion of the rights and liberties that we really cannot take for granted in the UK. They're so fundamental and important, and I think this is the time that we need to re-seize them before this kind of activity and this kind of technology becomes normalized.
Now, Kirsty, on vaccine hesitancy, what do you make of that? Because Chris Whitty, the Chief Medical Officer, is privately saying that he's worried about what vaccine passports do to vaccine hesitancy. What do you guys at the Tony Blair Institute think about that potential conflict?
Yeah, I think it's something that you need to pay really close attention to. So health passes have got two ways they help to reduce COVID. One is by reducing transmission, because if you're sure that everyone in a particular space has either had their full vaccination or has a recent negative test, then you can reduce the amount of transmission within that venue. And the government's leaked research said it could be by as much as 40 to 45%. And the second way is by providing people with a nudge or an incentive to get their vaccine and or to have that test. Obviously, the evidence around how it impacts people in terms of their willingness to take the vaccine is really mixed, and it's going to be different for different populations. There will be some people for whom they haven't got around to doing it, they don't see the benefit for them, they don't see the point, it just hasn't been part of what they've been doing, for whom needing to have a vaccine passport to go clubbing or to do something will be enough to say, okay, I'll go and get it. There'll be some for whom the reasons for not getting vaccinated are much more complicated and much more sort of deeply felt, and to reach those people you need a much smarter and broader range of mechanisms. Nobody's arguing that you shouldn't be using the full suite of tools to get to that population, from information campaigns, making it much more easily accessible, sharing the evidence and helping to reach communities who understandably have a real trust issue with government and with health services. So it's really complicated, but there are at least two ways in which health passes can help us tackle COVID, and I think that for that reason, we shouldn't be ignoring them. And can I just come back on the point about competence for governments? I find it really depressing when people say we shouldn't be using this or that technical tool because the government isn't competent to do it. The problem with that is not the technology, it's the government being competent. They must be competent, they should be competent to use these kind of things, and otherwise it sends a very sad signal about what services we can expect from the government and how we can expect them to look after the population and provide public services to us as we go forward and technology evolves even further.
Well, Kirsty, one of the points that Kate makes in her piece is this point about disenfranchisement. And maybe actually, Kate, you should make this point, because Kirsty there is talking about those who mistrust government. But I guess the point is that if you have vaccine passports, those who mistrust government are then denied services and hospitality and access to places.
So I think this point about mistrust in government, I'll start that again. I think this point about distrust in government is a really important one, because when we think about people who don't want to get vaxxed, we often think about very middle class people who are, doing it for extremely selfish reasons. And, frankly, those people do exist. But the figures that the politicians are really, really loath to talk about, but we highlight in the Spectator this week, are the ethnicity gaps in vaccine take-up and the wealth gap in vaccine take-up. It's something like 11% of the rich haven't had their vaccine, but nearly, I think, over a quarter of the poorest in society haven't had their vaccine. And, there are deep-bedded social reasons for this. And I don't think that the implementation of vaccine passports, again, we haven't seen any evidence in the UK that the implementation of vaccine passports is helping those groups, often minority groups, often those who are more vulnerable in society, to take up their jabs. We need a much more thoughtful and a better education campaign around this. I want to pick up on that point about transmission, because I think the Omicron variant has just completely decimated the argument around transmission in favor of vaccine passports. So with this new variant, the vaccines are still doing incredible work. They're protecting us against severe illness. That is the most important reason to get your vaccine. It's the best reason to get your vaccine. The boosters are also working miracles. The vaccines are still having great effect. But the Omicron variant does seem to quite successfully get around infection. Vaccines are not as protective as they once were when it comes to Omicron, especially there's a lot of evidence that AstraZeneca, for example, 2 jabs of that, which would get you a vaccine passport, is not stopping you from getting this virus or from transmitting it. It is hopefully stopping you from going to hospital. But this idea that if you're double jabbed with AstraZeneca and you're in a vaccine passport venue now, you are somehow less of a risk to others. Omicron has dented that argument quite a lot. And I just think that the benefits that we said we were going to get from vaccine passports have not appeared in the UK. But we see problems with the technology. We see government that can't control it. And yes, I suppose in your dream world, governments would be always thoughtful and capable of controlling these things, but history would suggest that they very, very rarely are, and I highly doubt that any government that's going to come along in the near future is necessarily going to change that. Basically, don't rely on that. Look at the technology and think, we're getting a glimpse into what government could control and how well they could do it. And if you don't like what you're seeing in that glimpse, and I certainly don't, then this is going to be the time to change it, because MPs at the end of the month may well have another opportunity to vote. And the benefits that we've gotten from the vaccine should mean that this real push for vaccine passports to prove your health status when you want to go about your business and live your life can be tossed out the window, because living with COVID has meant vaccines, it's meant testing, it's meant antivirals, but it really hasn't meant vaccine passports. These have been getting in the way, frankly, I think, of a broader educational conversation we need to have with people about why they need to take up their vaccines. It's politicizing the vaccines, and Cindy, as you started to hint at, even the Chief Medical Officer, Chris Whitty, is very concerned behind closed doors about what this is doing to our public debate around vaccines. They should always be seen as an attractive feature, because scare tactics very rarely work. And there could be real implications for, if we politicize vaccines in this way, what that means for future vaccination campaigns, especially the core vaccines that we need to help protect children. So, the evidence so far does not stack up in favor of vaccine passports. We have that very rare opportunity where something isn't embedded in society to actually say, no, we reject this, we've had the experiment, it's failed, and we're going to go in a different, more liberal direction. And thanks to the vaccines, frankly, we can do that.
Well, Kirsty, what do you say to that Omicron changes the game, firstly, but also secondly, that there's some people who just will never get the vaccine. They just simply don't want to. But if you implement some kind of passport system, then that means that they essentially become second-class citizens.
I wouldn't agree with that at all. I mean, Omicron does change the game, but the fact that it's more transmissible means we need to do all the more to reduce transmission. You won't ever get to an absolute stage where you can guarantee that everyone in a venue is free of COVID, or that you're reducing transmission to zero, but you can reduce it, and that's what you should do. In terms of the equity point, I think the stats on the black and minority ethnic community take-up rates are seriously concerning, and the social demographic take-up rates are a real worry. But the worry is that these people are vastly increased risk of getting seriously ill, dying, going into hospital, or getting long COVID, not that they'll have to take a lateral flow test if they want to go to a club. To me, that seems like a very small part of the problem indeed. I just wanted to mention something in Kate's piece that I really agreed with, which is it's great that there is a democratic process in action here. I think new bits of technology and new tools like this should always be subject to trials, piloting, broad public consultation. I think it's great that there's a sunset clause and there is opportunities to have a debate in Parliament about how this is working. But what I don't think is we've had enough of evidence yet, or enough enough kind of public discussion about how it's working to be able to make a really good long-term decision. So I would never suggest sort of abolishing them or ruling them out forever, but I think it's right that you can bring them in and out depending on the level of risk and the level of concern about COVID currently in the community. So it might be that we're at the stage with Omicron where we think, well, this is endemic, the damage to public health is manageable, and we're just going to live with this. And so it's right to phase out a whole suite of the measures that we've had in place, masks, social distancing, and health passes. It might be that we get a new variant cropping up at any time, as we could do, since we haven't got COVID under control throughout the world. And if that's more transmissible and or more deadly, we might well want to have a measure that we can put back into place, like a health pass, to say, well, we are doing everything we can to control the spread of this variant within our community.
All right, I mean, I'm afraid we have to stop it there, but Kirsty and Kate, thank you so much for joining Spectator TV. I'm sure we have lots more to talk about in future episodes.